Hello everybody, welcome to my channel. This is Dr. Hussain, and in this today's short video we will be discussing about the documentation of hypoglycemia and the treatment. So how do we document hypoglycemia? So any patient comes to you. So how to document hypoglycemia? So the documentation is by Whipple's triad. Triad, as you know, means 3. So what are the 3 things we should confirm? First, the symptoms of hypoglycemia. So in the previous video, we discussed about the symptoms of hypoglycemia. Second thing, if the blood glucose is less than 70 milligram per deciliter, that should be documented. Then the third thing is, after treatment, after giving glucose or giving sugar or giving carbohydrates, if the symptoms are reversed, if he is relieved of the symptoms. So these 3 things. One is symptoms, if the patient has symptoms of hypoglycemia. Second, if the blood glucose is less than 70 milligram per deciliter. Third, by treatment, if the symptoms are reversed. Then we document it as hypoglycemia. What is it called as? Whipple's triad. Now, how to treat hypoglycemia? So the treatment, always remember, as nurse, you should know if the patient is conscious or unconscious. If the patient is conscious, then we need to give him oral glucose or oral carbohydrates or oral sugar. So always remember to follow the rule of 15. What is the rule of 15? 15 grams of carbohydrates, 15 gram of sugar, 15 gram of glucose. Mix it in water or directly give it to the patient. After 15 minutes, again check the blood glucose. So this should be repeated till the blood glucose is greater than 70 milligram per deciliter. Second, if the patient is unconscious, then definitely we cannot give him orally. So what we should do? Give him IV, dextrose, IV fluids, 25% or 50% depending on the availability in your hospital. And if the nurse cannot get the IV access, and if it is difficult to get an IV access, then we can give 1 milligram glucagon intramuscularly or subcutaneously. So this is the alternative treatment for the management of hypoglycemia. So I hope it is clear to all of you, and please do not forget to like, follow and subscribe my channel, and we will be meeting in the next video. Thank you.